Welcome back to Untold Physio Stories podcast. I'm your host, Dr. Reed with Modern Manual Therapy and Edge Mobility System. Today I have a guest, Dr. Dan Chapman. How's it going today, Dan?
It's going well. It's going well. It's good to be here. Thank you for having me.
Yeah, we pop up in each other's LinkedIn feeds, and this is how these things happen.
That's exactly right. Yeah.
Right. So Dan had some issues, and I think it's just another valuable lesson and an interesting case, and hopefully listeners can learn something from your case, or at least think about something else, like a differential diagnosis. You want to give us a quick intro and then tell us what happened?
Yeah. So my name's Dan, and I run Summit Physical Therapy in Baltimore, Maryland. We're an out-of-network clinic here, and we are in network with Medicare. So I think technically that makes us a hybrid clinic. But it
Because
was.
no one can be out of network with Medicare, you mean?
Sorry, say again. Because
Because
nobody
no
can.
one can be, yeah,
Exactly.
right. Yeah.
Exactly. We don't
That's
really have that
that's
choice.
every out of network clinic. I guess that would include me as well.
That's right.
Yeah.
Um, it was an odd thing. I have I promise I'm not one of those people that goes around talking about being gluten free, but it does actually relate to this story where I get canker sores in my mouth whenever I eat wheat or gluten.
Okay.
And so usually, if I and
How
it
long
took
did
me
how long did it take you to figure that out?
decades. Like I went to dentists, different types of providers, and they're always like, this is just kind of what happens. And to me, it was, these things take usually 2 weeks to heal. And then I would go maybe 5 to 7 days without having one, and then I'd get another one, like years and years and years. And I was like, this is not normal, right? This is not your average canker sore. I changed my toothpaste. I mean, you name it, I did it. And then I actually ended up cutting out wheat for a different reason, because I suffer with eczema for a very long time. I cut it out for that reason, and then like that, my canker sores went away after 10 plus years of having them.
How about your eczema?
Eczema is significantly better. Yeah. So, whenever I tell my dermatologist this, they're like, we don't really know about nutrition, and so who knows, man. But like,
Right.
it seems to
Uh,
work for me.
It seems like really no one does in a way.
Exactly. Yeah. So that's just kind of how it came about. But I was traveling. This was maybe a couple months ago now. I was traveling, and usually I'm pretty good about my diet, but then suddenly, when you're traveling, it's not always easy to find those gluten-free options. And then I just broke, and woke up the next day. I had a canker sore right on that like right cheek area where you put your tongue into the side of your cheek. That's right where it
But
was.
I gotta interrupt you though. Was it something I always tell patients, if you gotta cheat,
It's
especially
the
when it comes to
worst.
your diet, you gotta make sure that it's something you want. Was it something that you wanted, or is it something that you haven't had in a while? Or is it
Yeah,
just
no,
like,
it was
oh, I
like it
just
was like a big Impossible Burger Whopper, like the big double Whopper or whatever at Burger
man, the
King.
Impossible Burger though, you're still just better off getting like normal beef.
Yeah, so I also don't eat meat. I don't eat anything, man. It's just like air and water. But like, yeah, so I
No, I mean I get it. I used to be 100% plant-based for a while, and then we
yeah,
were gluten-free for my son's constipation,
yeah,
severe constipation for like maybe 8 months. So I get it. I've given up things before, but I gradually like start introducing them back in and see it's like an anti-elimination diet in a
yeah,
way.
absolutely, man. It's like traveling is like it has made me a more creative cook for sure.
Mhm.
And but yeah, so I did break. And lo and behold, the next day I woke up, I had that canker sore right in the cheek, and within probably a day, I just had this pounding headache that was, up to my temple and then a little bit above my right eye, and it was kind of just with me throughout the whole day. And then, but I did notice it would get, I'm a PT, so I'm kind of thinking, okay, what makes it worse? What makes it better? You know, talking and eating, right? I was on the phone, gets worse. I'm talking with patients, gets worse. Um, and I was trying to figure out what it was. And, obviously I started digging into my masseter here in the jaw, and it just exaggerates the headache significantly. But that manual pressure, that hands-on massage, then would calm it down for a short period of time, right? Maybe I'd get like a couple hours of relief, and then it would come right back. And so I kind of realized I was putting two and two together. I got this canker sore. I can do some manual work to try to calm down the muscular tension here. And again, it was like right into that masseter. Um, but I kind of had a feeling in the back of my head, as soon as this canker sores goes away, I'm going to be fine, right? And lo and behold, a week later, canker sore starts to calm down. headache goes right away. And to me, it sounds like a really, really basic. Okay, what's the clinical significance of this? But it's a if you think about it, it's a headache caused by a soft tissue referral pattern that is a musculoskeletal irritation that's generated by a non-musculoskeletal source, right? So like there's like a bit of a chain here in
Yeah,
thinking
yeah.
about how this headache came across. Um, but for me, I see this a lot, right? I see it with radicular pain, right? You have people that have like a hot radicular pain going down, the posterior thigh, wrapping around to the peroneals. Once you calm down the nerve pain, if you go back through that soft tissue, those peroneals are irritated, the hamstrings are irritated, the posterior lateral soft tissue around the hip is irritated, and so there's two thoughts in my mind going on when I try to break down this kind of what happened here. And on one, it might be what I think in the pain neuroscience world they kind of call it noisy neighbors, right? You have pain in an area, and then it creates tension and pain in the muscles and structures around that area as well, right? So you have a masseter muscle that's irritated by the canker sore and the pain there. But then also there's the thought of, even though I didn't realize or think about it, I may have just been chewing and talking differently, trying to avoid the pain in my cheek, using the masseter differently, using the muscles around my jaw differently, and putting a new undue stress on those muscles that they're not used to, right? But either way, I thought it was an interesting kind of clinical thought process to talk about pain, talk about musculoskeletal referral sources, because we get those all the time when it comes to headaches, right? Whether it be from the neck or the jaw. And just a goofy case of a headache and what caused it.
No, it is interesting. It's funny though. I'm trying to think if it was a patient, it would
Yeah,
be harder to say, oh well, you have this history, so
totally.
let's just say let's just wait to see for when it goes away because someone would want like it's almost like you'd have to mash around a bit on
Oh, yeah.
peripherally sensitized tissues just to get that buy-in or the therapeutic alliance. Because if you just said wait and see, even if you said, "Hey, this happened," unless you said the authority, like you pulled the authoritarian kind of, "Oh, well, this happened to me. I have a very similar history, very similar medical background, and coincidentally, this happened to me last year, and when the canker sore went away, that this also went away."
Yeah.
But otherwise, if this hadn't happened to you, and if I was just saying like, "Hey, let's just wait and see," because
Oh, yeah.
I heard about a case,
Hmm.
from the journal anecdotal evidence, I call it,
Yeah.
and let's just wait and see. It's even when you said like the perennials or the hamstring and everything, I think the tendency, the erroneous tendency would be, well, these things are tender. Let me mash around on them a bit
Hmm.
because obviously it's some sort of issues in the tissues, but it's really not.
Right. Exactly.
That was more like you said, noisy neighbors or it's secondary excitation of the nervous system rather than from some sort of actual trauma or true
Right.
inflammation.
Yeah. And
Yeah,
so to me, when it was going through my head, I was like, is this something that I seek out care for? For me, no, because I'm pretty sure it's going to go away in a week. But if someone's already in my office, I'm going to do everything I can to explain to the fact that, like, I actually think their pain is a cause of something else. But there's still things that we could do, right? There's manual
yeah,
work. I can teach you how to do your manual work. I can teach you how to stretch these muscles and calm them down. But we also need to make sure that when someone is coming in with headaches, that we're not just checking the posterior neck or the lateral neck, the upper traps, obviously, the levator, like all those are very common referral sources. Checking the jaw, but then also going a little bit further because it might be the jaw, but it might also actually be a dental issue. For me, it
yeah.
wasn't, but if
I mean,
someone,
in a way, it's kind of a dental issue, but I
yeah,
mean, a lot of dentists would say, "Oh, you probably brux at night," or especially me, I get a lot of canker sores in my cheek, but it's because I have a malocclusion, and
yep,
it's like even when I was 100% plant-based, I wasn't because I'm always biting myself.
yeah.
So,
Oh, and then it just
yeah,
gets inflamed, and then you
I know.
bite
And
it
then,
again.
yeah, then you just bite it again. It's like this vicious cycle of now my cheek is pretty much permanently shaped like my teeth,
Yeah,
and it's always sticking out. And I can't not bite it. I have to
yeah,
basically would not. Maybe if I did a no chew diet, like I tell my severely sensitized TMJ patients, no chew diet for 2 weeks or something,
yeah.
give that time to. cut it down. But yeah, it's rough.
It's funny you mentioned that because that is the exact example that I give to, or when you're talking with patients, you're trying to explain pain and or whatever it is that they have going on. One of the common examples I usually use is literally that exact biting the inside of your cheek for nerve pain, where it's like, hey, there's certain pains that you want to lean into. Let's just talk about maybe like a tendon related pain. We want to work into some of that tendon related pain. With nerve pain, a lot of times we actually want to back off because the more you poke it, the more irritated it gets. And it's just like when you bite the inside of your cheek, right? It gets inflamed, you bite it again, it gets more inflamed, and all that thing is doing is trying to calm down and heal, but you just keep making it worse. And that's that typical runner that comes in with hamstring pain, and they just keep stretching and stretching and stretching, but it's actually a sciatic pain, and they just keep irritating it over and over again.
Mhm.
Um, it's just funny you brought that up. That's like literally the exact example that I use.
I'm glad you say that with nerve pain too, because back when I took David Butler's first explained pain course in 2002, I don't even know if you were like practicing or
Nope.
alive or whatever. I don't know. Some people are so young who come on my podcast now. I may or may not have been practicing for already 4 or 5 years, but anyway, he had said that, we're starting to move away from nerve tensioners and starting to go to nerve sliders
Right.
for extremely sensitized conditions. And I'm just like, well, if it's any kind of nerve problem, I don't stretch it at all.
Right.
I
Right.
might
Yeah.
I might
Yeah.
do I might do the test to sensitize to see if median or radial ulnar or sciatic or femoral is
Totally.
sensitized, but I'm not going to stretch it just because it hurts, right?
Yeah.
Yeah.
Exactly. Yeah.
All
And
right.
occasionally, every now and then, I do find someone who benefits from that, but it is not my first go, and it is
Yeah.
very rare.
Yeah.
But yeah,
For
no.
sure.
It's
Especially if it's like a peripherally sensitized nerve, they usually don't need stretching.
yeah, yeah,
Yeah.
absolutely. But yeah,
All right.
it's just a
That's a
fun.
great case.
Yeah, it's a fun.
Interesting. I mean, now I have another thing to ask for. Like, this is why I do this podcast. Someone else had said that they had a patient, and it ended up being their student figuring out that this patient was severely constipated because it was just like the student was just going through these like random list of questions of that they are just supposed to ask, and it's not
Yeah.
something that we asked, but it was like, yeah, severe, what appeared to be mechanical low back pain, and they were just like severely constipated.
Wow. Okay. See, now I just learned something
Yeah,
too.
see, it's just another thing I say. But it's exactly that example. I don't usually ask people, "Hey, do you have ulcers? Do you have canker
Yeah.
sores?"
Totally.
Yeah. Because I've had people with severe tooth infections that also mimicked masseter pain.
Yeah.
Um, so that's like something I asked for. Have you gone to the dentist recently? But I haven't asked for that, and it's important.
Yeah.
But it is interesting about how gluten causes that. Because I've also had patients who eliminated gluten, their headaches went away. They
Mhm.
have a little bit of gluten, their headaches immediately come back. And this is
Yep.
even after a head and neck trauma. This patient in
Mhm.
particular, she got hit with a softball, and she had like very severe occipital pain. You can see like he hit by a softball like this
Right. Sure.
twice. But nothing ever made it better, including a ton of retractions and soft tissue work and everything, other than her giving up gluten. And that's before I knew anything about nutrition.
Very
I,
interesting.
Before back then, I used to just say, "Hey, why don't you try giving up gluten?" Now I just say, "Hey, let's try going plant-based,
Yeah.
then gluten, then elimination diet, and then put things back in." So I'm a bit more scientific about it
Yeah.
because I actually studied nutrition. But back then, when I knew nothing about it, and I was like, "Let's see what happens," and then she came back. She's like, "You know what? My mom has celiac disease. She doesn't have celiacs, but with a
Yeah.
history,
Absolutely.
yeah, yeah,
And I think the other trigger is it was when I looked it up on Up to Date. My mom's a nurse practitioner, so I get those. She gets to send me like the up to date things. Um, it's gluten and dairy are the top two triggers for the canker
Mm,
sores. Just for any other
right.
listeners out there.
Of canker sores, but also I would say anything,
Yeah, lots of things, right?
right? Things that just make you feel bad, right? Things that sensitize your system. Yeah.
Yeah, absolutely. Thank you for having me on, Erson. This is great.
Yeah, no problem. Thanks for coming on. Hey, is there anywhere people can find you? They can connect with you on LinkedIn?
Yeah, yeah. Please find me on LinkedIn, Dan Chapman, DBT, and then also danchapman.dpt is where I'm at on Instagram as well.
All right. You guys hiring or anything?
We did actually just hire. It took a year to find someone, and I found someone amazing, so I'm pretty stoked about that. But he's
That's
already
great.
full, which is great.
That's good.
So
Because last time I was at the Baltimore area, the person I know who owns like maybe 4 or 5 clinics, she has like 50 to 60 employees. She would say she had a ton of people from India and other countries because she said like I can't find anyone to
it's
take these
it was so
positions.
hard. It was so So hard to find someone. Yeah. I
Yeah.
had one applicant before him, and it was just someone who worked at McDonald's and was not a physical therapist. Like that was the only
For
applicant I got for the job.
for a physical therapist job.
Yes, sir.
And he's like, hey, I want to be a physical
He was
therapist.
like, yeah, let's do it, man.
Yeah, this has got great, way better benefits and pay than McDonald's.
Yeah, so no, it was
That
rough.
is wow. That is a sign of our times right here, where people who without degrees are now applying for
Yep.
professional jobs.
Yeah, yeah, that
Wow,
was
that's
rough.
almost. I mean, that's almost a story in itself. I'm sure it's not a very long one, but it's hilarious. All
Oh
right, Dan,
man.
thanks for coming on.
Thank you so much. Have a good one, Erson.
Yeah. Hey, if you guys learned anything from this podcast, you want to connect with me or Dan, check us out on LinkedIn. Please rate Untold Physio Stories 5 stars wherever you listen to podcasts, especially Spotify and Apple. As that just helps our discoverability. That goes for you too, Dan. When
Yeah,
I
I'm
when
on
I
it right
tag
now.
you on LinkedIn, or yeah, just look it up and please rate me 5 stars.
Perfect. I got you.
All right. Hey, have a great day.
Hey, you too, Erson.